Everyone, welcome to the Lakeview audio podcast series. I'm pleased today to be joined with Bryan, Lapkin, and Russell Guccio with Foundations Wellness out of Port Saint Lucie. Welcome, guys.
Thanks for having us.
Thanks for having us.
We're really happy
to be here.
Yeah, we're happy to have you here in Jacksonville, learning about Lakeview, but also for us to get to know you guys a little bit more and also understand more about Foundations Wellness. Before we get into the specifics about your program, let's talk a little bit about you all. Bryan, tell me a little bit about your background and what made you say, I want to open up an outpatient program.
I was in, I tried to get sober for a long time, and I never could, and I just remember people would always come in. I would see, when I was at other treatment centers, I would see the care and concern and people living great lives come in, and tell me, hey, they're staying sober day by day. And then when I did get sober, I just wanted to continue on that path and continue to help people. And the opportunity came, and I just never saw a better way to continue to help people than open a place up and then see the miracles happen and see people who are going through the same stuff I went through or friends and family went through. And then now today they are standing, in front of me, and they're still sober, and they say, thank you to all your staff and everyone that helped me out. And and that's just every morning when I know that I'm doing the best I can to help somebody. There's nothing better for myself.
I totally agree with you. It's great step work as well, when you can give back the way that you do when you're doing good work in your recovery.
Absolutely.
That's fantastic. Well, so Russell, you're the business development director for Foundations Wellness.
Yes.
So how did you get into working with them, and why are you so excited about working in the recovery community?
I am in recovery myself for 3 years now. I'm originally from New York, Manhattan, Staten Island, Brooklyn. I was a high-functioning opiate addict for many years, and then I got into heroin, and of course that was a quick downfall. I have family down in West Palm Beach, so when I decided to go to treatment finally, I said, I'll go to treatment in Florida. I'll spend some time with my family before I go back to my job in Manhattan. Didn't know anything about recovery or the recovery process or what entails in actively keeping recovery. So when I came down here to treatment, I spent my 40-something days inpatient. I had a couple of months that I was on leave of absence from my work. I was going to stay with my sister for a couple of months and go back home. They convinced me to do sober living because this is what we're supposed to do. Like they laid out the process for me of what I'm supposed to do, and I stopped making my own decisions, and I kind of listened to other people and took their advice. So I said, I'll give this a try because I wanted to get sober. I wanted to get clean. I didn't know how to do it. I'll listen to the people that do know how to do it. So after about a few weeks of being in the recovery community, I realized that this was something that I wanted to pursue as a career. I resigned from my position as a computer engineer from a company in Manhattan. Had whatever belongings I wanted, shipped back down here. And within about, I would say maybe 8 or 9 months, I started working in the recovery field. I started as a tech. Then I moved into admissions and outreach coordinator and now business development for Foundations. I had met 2 of the owners of Foundations at another treatment center that I had worked at, the treatment center that I had went to. One of them was the admissions rep that I had spoke to on the phone when I contacted the treatment center. And she was responsible for me getting down to Florida and going to the facility that I had went to. And I'm honored to continue to work for her. It's kind of cool how that works out. She was the first person that I spoke to in Florida. I went to the treatment center, and now I work for her at her treatment center. So that's a great feeling. So
yeah, absolutely.
Happy to be here.
Nice circle, like a continuum, isn't it? It's good. So tell us a little bit about Foundations Wellness. You have a day and night program. You have an IOP program. Sounds like you have a really solid aftercare program. What is it specifically that a patient would experience when they come into the program?
So first we do day and night, which is considered PHP, day-night treatment. Typically that is 30 to 40 days, depending on the treatment program that we draft up for the individual. After 30 to 40 days of PHP, they'll step down into the IOP program, to the IOP house for anywhere between 60 to 90 days, They are welcome to stay longer if they feel that they need to. Then they'll step down into outpatient for about 60 days or so, which is once a week sessions, while they can live in. They'll step down from the IOP house to one of the actual sober living houses. So when they come in, we don't do detox at our facility, so we outsource our detox. So they'll come in fully detoxed. We will pair them with an intake coordinator who'll do like a biopsychosocial. We'll get some background on them, usage history, any past traumas, any kind of psychotherapy issues that need to be addressed, and we'll kind of pair them with which counselor or therapist, primary therapist, we feel would be the best fit for them. Although they do have access to all of the therapists there. They'll meet with our medical director and our psychiatrist if they need to continue any medications, or if any medications will be beneficial to their recovery. We'll present them to them. So a typical day at our facility, they will wake up, or a PHP day, a day-night treatment day, wake up around 7:30. By about 8:15, we leave for the vans to come to the facility. And from 9 to 11:30, we do a morning meditation group. So we have a community group where everyone kind of checks in. How was your day? How was the meeting you went to last night? Is there anything that anybody wants to talk about? And we're kind of in a group setting. If there's anyone who's having a struggle or something, or even with another person in the house or the community, we kind of air it out and get to the bottom of it and make sure everything is good for the day moving forward. Then we'll break for lunch. We'll come back for the afternoon groups from 1 to 4. And during this time, counselors will do individual sessions based on schedule. We do gender-specific groups, process groups, anger management. We have a wellness group that comes in that will do massages and acupuncture and chiropractor services. We do yoga, mindful meditation, things of that nature throughout the day. Then out at nighttime, we either bring a 12-step meeting in, or we take them to an outside 12-step meeting, so they can get familiar with. See, some of the patients will stay locally. Some of them will go back home to their families, to their jobs, what have you. And the reason why we take them to the outside meetings is so if they go back home to their environment after 60 days or so, 90 days or so, they're comfortable in an AA, NA meeting, putting their hand up, asking for help, letting their feelings out, saying, hey, I'm struggling, I need to talk to somebody, and it prepares them for that type of situation. So we really encourage them to participate in those outside groups while they're inpatient with us. And we kind of monitor that and say, well, hey, it's been a couple of weeks, maybe you should start getting your hand up. Even if it's just to introduce yourself. Say, hey, this is my first time sharing, just want to put my name out there, and hello. Something like
great.
that.
So you've got a really solid clinical component, and it's wrapped with 12 steps to really help them in their post-treatment experience, which is terrific. If someone were trying to access your services and wanted to reach out to Foundations Wellness for your treatment, how could they get in touch with you?
We have a website, which is www.foundationswellness.net. We can also find us on Facebook under Foundations Wellness Center. Those would be the easiest way to get in touch with us. Their 800 numbers are on there. Some email addresses to our admissions team, and we're available 24/7 through those channels.
That's great. 24/7 is important because obviously people aren't always seeking treatment between 8 to 5, so it's nice to know that you guys take calls after hours, which is good.
Even if someone is hesitant to make the call, they can message us through Facebook.
Good.
We have someone who's on call 24/7. We rotate that between admissions intake coordinators, so they can reach someone at any time within minutes.
Wonderful. That's great. Well, thank you guys both for taking the time to come to Jacksonville to learn about Lakeview, and we're really happy to have you guys on our radar. For those of you that are interested in learning more about Lakeview Health, we invite you to contact us at 866-877-0142, or if you want to check us out online, visit us at lakeviewhealth.com. Thanks, guys.
Thank you.